Ever wondered how crucial clinical electives in anesthesia are to your medical career? Clinical electives, especially those in anesthesia, are like a goldmine of opportunities. They are not just a box-ticking exercise for your medical degree, but a crucial stepping stone in your medical journey. Now you might wonder, what makes these electives so important? There are three main reasons. Firstly, they provide the chance to develop practical skills. You see, medicine isn't just about reading textbooks and understanding theories, it's about applying that knowledge in real-world scenarios. Anesthesia, in particular, requires a unique set of skills. From intubating patients to managing their pain levels, these are skills you can only learn by doing. Secondly, clinical electives in anesthesia offer exposure to real-life situations. In a controlled environment, you learn to handle the pressure of an operating room, deal with unforeseen complications, and make crucial decisions. These experiences are invaluable in preparing you for your future career. Lastly, these electives give you an opportunity to learn from experienced anesthesiologists. They offer pearls of wisdom, share their experiences, and guide you through complex procedures. Their mentorship can shape your understanding of the field and help you develop a professional approach. So what's the takeaway here? Clinical electives in anesthesia are not just another part of your medical curriculum. They're an integral part of your career development. They help you transition from a medical student to a proficient healthcare professional. And it's not just about the technical skills. These electives also teach you about empathy, communication, and teamwork. They help you understand the patient's perspective and the importance of patient-centered care. So, whether it's your first elective or your fifth, approach each one with curiosity and a willingness to learn. Take advantage of every opportunity to grow, both as a student and as a future doctor. So, remember, the more hands-on experience you gain, the more prepared you will be for the challenges that lie ahead. Now that we know why anesthesia electives are important, how do we make the most of them? The first strategy is active participation. Immerse yourself in the experience. This is not your typical classroom setup where you sit and absorb information passively. Anesthesia electives demand your full involvement. You're not just a spectator, you're part of the team. So jump in, get your hands dirty, and take part in the procedures. It's through this hands-on experience that you'll gain a deeper understanding of anesthesia. Next, ask questions. Remember, there's no such thing as a silly question. If there's something you don't understand, ask. If there's a procedure you're curious about, ask. Your mentors are there to guide you. They've been in your shoes before, and they're more than willing to share their knowledge. Don't hold back. Your curiosity may lead to invaluable learning opportunities. Thirdly, take notes, and I mean copious notes. Write down everything, from the simplest procedure to the most complex case you've encountered. These notes will serve as your personalized reference material, something you can revisit and learn from long after your anesthesia elective is over. But succeeding in anesthesia electives is not just about acquiring knowledge. It's also about building relationships. Networking is critical in the medical field. Connect with professionals in the field of anesthesia. Learn from their experiences, their successes, and even their failures. They can provide you with insights that you won't find in textbooks. Also, don't forget about your peers. You're all on the same journey. Learn from each other, share experiences and insights. Who knows, the person next to you might be your future colleague or even your partner in a groundbreaking anesthesia research. Success in anesthesia electives is not merely about passing, but about learning, growing, and networking. This experience is a stepping stone to your career in anesthesia. Make the most out of it. Embrace every opportunity, every challenge, and every lesson. Remember, you're not just learning anesthesia, you're becoming an anesthesiologist. Shifting gears, have you ever found yourself overwhelmed by neuro exams? It's a common sentiment, and you're far from alone if you've felt this way. Neurology is a fascinating field, but it's also one of the most complex areas of study in medicine. It's like a labyrinth, with its intricate networks of neurons, synapses, and neurotransmitters, not to mention the countless disorders that can affect the brain and nervous system. One of the main challenges students face when studying for neuro exams is the sheer volume of information to be absorbed. There's a vast amount of knowledge to be gained, from the basic anatomy and physiology of the nervous system, to the nuances of neurological disorders, to the intricate details of diagnostic procedures and treatments. It's a lot to take in, and it can often feel like you're trying to drink from a fire hose. Another challenge is the complexity of the subject matter. Neurology isn't just about memorizing facts and figures. It requires a deep understanding of how different parts of the nervous system interact, how they can be affected by various conditions, and how to interpret the often subtle signs of neurological disorders. It's a field that demands critical thinking and problem-solving skills, and it can be daunting for those who are more comfortable with straightforward black and white subjects. The depth and breadth of neurology also mean that it's a field where new discoveries and advancements are constantly being made. This can be exciting, but it also adds another layer of difficulty, as students have to stay up to date with the latest research and developments. Despite these challenges, don't be disheartened. Neuro exams, like any other hurdle in your medical journey, can be overcome. It's all about developing a solid study strategy, understanding how to break down complex concepts into manageable chunks, and being persistent in your efforts. Remember, every expert was once a beginner, and every neurologist started where you are now. Neuro exams can be tough, but with the right approach, they can be conquered. So how can we effectively prepare for neuro exams? An excellent question, and one that can be answered with a few practical tips. Firstly, it's crucial to understand that neurology is not about memorization. While there are numerous facts and figures to learn, understanding the concepts behind them is far more important. Each piece of information is a part of a larger puzzle, and by understanding how they fit together, you strengthen your comprehension and recall of the material. Try to grasp the why behind the what, and you'll find that the pieces start to fall into place. Next, consider using diagrams. Neurology is a highly visual field with complex structures and pathways that can be challenging to visualize. Diagrams can help you understand these concepts better. They can be found in textbooks, online resources, or you can even create your own. The act of drawing out these structures and pathways can reinforce your understanding and aid in recall. Thirdly, maintain a regular study schedule. Neurology is a vast field, and it's easy to feel overwhelmed. By breaking your study material into manageable chunks and studying a little bit each day, you can make the task seem less daunting and more manageable. Consistency is key here. But don't forget to take breaks. Studying for hours on end is not only exhausting but also less effective. Your brain needs time to process and consolidate what you've learned. So, take regular short breaks, get up and move around, and make sure you're getting enough sleep. Lastly, don't hesitate to use additional resources. There are numerous online platforms and textbooks that can help you understand complex concepts, provide practice questions, and offer study strategies. These resources can supplement your learning and provide different perspectives on the material. Remember, understanding the why behind the what can make a world of difference in your neuro exam preparation. So take these tips to heart, and you'll be well on your way to acing your neuro exams. Let's quickly recap what we've discussed today. We started by underlining the importance of clinical electives in anesthesia, a field that demands precision, focus, and a deep understanding of human physiology. Clinical electives offer a chance to gain hands-on experience and to apply theoretical knowledge in real-life settings. They provide an invaluable opportunity to understand the nuances of patient care, the dynamics of the operating room, and the intricacies of anesthesia administration. We then delved into strategies to excel in these electives. Emphasizing the need to be proactive, we highlighted the importance of asking questions, seeking feedback, and continuously learning. We stressed the need to actively engage with the team, to be punctual, and to show dedication and commitment. We also touched upon the significance of studying the patient's health history, understanding their condition, and planning the anesthesia accordingly. Next, we tackled the challenging realm of neuro exams. These exams, with their complex questions and detailed content, test not just your knowledge but also your ability to apply that knowledge in a clinical context. We acknowledged the difficulty of mastering the vast subject of neurology, but also reminded you that it's not an insurmountable task. Finally, we shared tips for studying effectively for neuro exams. We recommended breaking down the study material into manageable chunks, creating a structured study plan, and revising regularly. We advised using visual aids like diagrams and flowcharts to understand complex concepts, and suggested practicing with past exam papers to familiarize yourself with the exam format. So as we wrap up, remember that the journey to becoming a proficient anesthesiologist or a neurologist is challenging, but with the right approach, it's certainly achievable. Whether it's acing your anesthesia electives or conquering neuro exams, remember that success comes to those who are prepared, proactive, and persistent. Keep learning, keep growing,